What's up, everybody? Welcome to the J3U podcast. I'm your host, John Jewett. With me is Luke Miller. And once you go big on PEDs, can you go back? That's the question we're going to dive into today. I wanted more. I was like, there's all some things I come up with, but
once you fill it up, can you take it out?
So, yeah, it's a conversation around guys that have used high amounts of PEDs, or girls. The same is going to apply here. If you use that amount before, does it still work? Can you dial back the dosage and get the same effect, or can you get a better effect? And just kind of what's the situation around that where it applies? It probably first starts with like the why. Why is it even a topic of conversation? I think for the obvious reasons, but in case you're wondering, there's a few.
Yeah, I think habits of coaches over time is kind of where some of it comes from. So like they've nailed it with X client who used X amount. And so this starts to guide their decision making across their clientele across the board, no matter the experience level or the level of tissue. And so this is kind of where I think one of the directions that you get a lot of this comes from is you have one good experience as a more anecdotal based coach, and that kind of starts to pervade itself across coaching culture within their little sector.
I didn't even think about that piece of it, how that even becomes a thing. Usually that is the playbook of that coach, right? I'll say like that was how I was exposed. Like, when I was coming up, it was, all right, this is my coach and this is what you do to get your pro card. And it's like, wow, this is more than I've ever taken. I got more results than I've ever had. Go figure, right? But then also that's like, you only know what you've been shown. So when you coach people, then it's like, well, this works really, really well. Like I know for myself, then you give it out to all your other clients. Lots of issues around that, because then you don't really understand the rationale. Probably the coach that gave it to you didn't either. Just like, hey, just throw the kitchen sink at it. It's like, hopefully something works and sticks there on the wall. But other reason is just from a coach that's now aware, getting the client and with health considerations in mind. So if you have a client that comes to you and they're on really high amounts of gear and you're like, this is year 1 or 2 for this individual, they're in their 20s maybe, you're like, well, what is this when you're in your 30s? Okay, this is something that we need to adjust, because we can't do this for the next 10 years in bodybuilding. Then at the same side, that coach is not only about health, but also, hey, if you're not doing all the other variables correctly, do they still need this high amount of gear in place? And potentially that amount of gear is masking the poor variable control of the other things, right? So you're not nailing nutrition and training, and you're using all this gear. It's like, we'll just get the basics in place and pull back on gear.
Yeah, I think this dialogue is where I see a lot of this happen, and like where you can actually pull out more from less, which we'll dive into a little bit deeper as we get into the conversation. Is like there's almost like when we talk about what model gets used, low, medium, high risk, obviously we need to look at all the need that's associated with each one, but in the context of the situations in which they're used. But there's also like I'm not finding the right words for it, but like a level of execution that needs to be present in order to warrant the deployment of compounds into this level. And it's like, if you're not making the most of recovery capacity, recovery metrics, training, and the details of training, nutrition, and the consistency of nutrition, it's like, man, you're not even warranting the ability to be able to use this at its fullest capacity, you know?
Yeah, I mean, this is, and I guess that goes to the other why, because you're going to be able to gain so much more runway, getting more out of less. And I know that seems counterintuitive. More from less is not a thing. More does more, right? But like, I explained to someone, and Like if you had someone that came in, you're a doctor, your patient comes in, right? They have high blood pressure, they're overweight, they eat fast food every single day and not the salad at Chick-fil-A. And they smoke and they don't exercise. You're like, all right, listen, you got to do all these things and change your lifestyle, and you won't need this blood pressure medication. They're like, I'm not doing any of that. Give me the blood pressure medication. They need the maximum dosage to get an effect, right? That same person 5 years later, they're like, I gotta change this stuff. They change the diet, they quit smoking, they start exercising. Lo and behold, they can like cut their blood pressure medication in half and get the same effect out of it. PEDs can work the exact same way when you think about it. If you have someone that's young, that they don't sleep how they should with routine, they work multiple jobs, and their like training isn't on par. Nutrition, they're like missing meals, and sometimes they just have to double up and eat the fast food meal. And they're having to mask all that with a high amount of PEDs to get the effect. Once you dial that in, absolutely you could pull back the dosage and get the same, if not more, effect out of it, just like our guy that needs his blood pressure medication.
Yeah, absolutely. I think this is like, because we always seem to relay back the situation to blood pressure medication, whether it's training volume or PE dosing. But I think it's a more common situation than people realize, right? Because I think there's a psychology component to this too. We coach a lot of people who are very type A and very like, I'm going to do whatever it takes, not understanding that doing whatever it takes potentially entails taking that progression time over time alongside learning as a client how to nail all these other variables well, because there's certainly a learning process in executing at a very high level when it comes to consistency in nutrition, consistency in training, learning what you need to learn in order to execute at a high level on the training floor. And I think that if we more so look at the approach of I'm going to do whatever it takes, leading into learning as much as you can as a client in order to execute at that high level, we'll start to run away from the dialogue of doing whatever it takes leading to this high PED usage, more so creating better athletes that are better athletes over time.
Yeah, a lot of times when I hear the "I'll do whatever it takes" coach, it's a great mentality. I be the same way. Like, you want me to train to death, I would do it, right? You want to take all the drugs, I'll do it, whatever it takes, right, coach? At the same time, not like all that it takes does not mean better. And a lot of those individuals see like overtraining issues are present. They won't take rest days to pull back. They're ones that will do even extra cardio sometimes, or cardio harder than you intend them to do. Or there's individuals that maybe they're even taking more than what you want them to and driving more systemic stress. So it's not always harder and more is better. And so there is a balance to strike with those individuals, but the mentality is great of like, hey, I'm a workhorse. You won't hear me complain. There's like even problems around that and the balance to find with those type of clients too.
Yeah, for sure. Absolutely. So
with the psychology of it, like you mentioned, with those individuals, that's tough to reel them back in because they have the all mentality, take more. Why don't I just get there faster and I'll take the gear? I'll just learn it as it comes, but I'll still get the result. And yeah, fair play. Like you will. It's just short-sighted. I think it's an immature outlook on your competitive career, because it's still only looking at like, hey, your next show, 16 weeks. I just need this pro card. I'm all in. Give me all the drugs. But it's like, oh, you got a pro card. Then you jumped out of your pond into the ocean. You're like, oh man, what do I do now? It's like, well, you did everything already. It's like, oh, okay. Now it's just more. I should have like this out a little bit more. So I think maybe it's even this culturally now. Our society is so fast paced and you want it tomorrow. And it used to be like, there's more of a reality around pro cards or pro wins, all this. is like a year's endeavor, right? Not year endeavor.
Yeah.
And so the idea is like, oh yeah, 2 years I'll be like at the Olympia. When really it's like, man, 6+ years maybe for a pro card. It's just not like that though, because pro cards are more easily obtained.
Yeah.
So I think some of that maybe has driven that, and the patience part is not there. Um, Patience to, for one, to achieve high success, but also to pace out those like
Yeah.
implementation of something that can put you at high risk and cut you short if you think about how long you're going to be doing this for.
Yeah, and I think potentially with the popularity of the sport ever rising and probably at its peak that it's ever been, you are catching more individuals who are genetically capable of the quick rise, whether the compound usage is high or not. And so we're having more examples of these people 3 or 4 years into their training career, like winning a pro card and then winning a pro show and then making it to the Olympia. And because there's more evidence of that, there's more belief that that should be me. Not necessarily realizing that there is going to be a discrepancy in genetic capacity between athletes. And then the expectation is like you get 3 years into your training career and you're not doing the same things as that individual. And then it's just go from there. So I think one of the big things kind of as we start to dive in is like, what do we do? Like one of the big things to discuss within this is like, how do we take a step back with an athlete and start to map this out where we can still maximize progress, potentially discuss where compound usage at a higher level could be needed more than others. Because I do see the association. I know you see this as well. Like 18 weeks out, contest prep is here, take all the drugs and make it happen. And it's a little bit backwards when you think about what's actually needed to move a physique up the next level, and then what's actually needed to successfully complete a contest prep.
Yeah. So when we are looking at deployment, I think that's where I've had clients come to me before. And they're like, wow, we're on prep. I've never used so little drug and I look better than I ever have. It's like, okay, we have to like put this into context for people because it's not, I will say like more does more, right? But in a prep scenario, you have to understand that environment of what you're trying to do with PEDs. And truly it's just muscle retention. And as someone that is, I'm all in coach, where do you stop with that? And so a lot of guys are going like a little bit extra to make sure you cover all bases. And so it's like, how much can you pull that back on prep to do the job of what you want it to, is just retain tissue. And you can pull it back quite a bit and make that job happen. And at some point, you're not going to be in a position to build tissue on prep. And so you just have this high anabolic load, not being as productive, but still driving the stress. So it's trying to find that line of where you're just retaining tissue and you're also not driving the stress that you need. So a lot of times you're able to pull people back quite a bit on a prep when in the past they use the most on prep, when it's just the wrong rationale of what the drug is trying to do on prep.
Yeah.
I think that's one situation where you can pull someone back and they might have a perception that they're getting more out of it.
Yeah, I think I've almost included this as a part of the needs analysis nowadays. Is like, what is the level of experience and level of tissue this athlete carries? And then what does the PD level look like from a history perspective? Because during a contest prep, like I know that, the peak doses that they've ran, if it's the situation where it's always been during a contest prep where they run the most, I'm not going to need that much when it comes to retaining tissue across a prep. And there's an easy way to scale that back where we're scaling it to just the amount where we're watching that performance continue to rise and or hold across a prep. We're retaining tissue, all of this stuff. I think where it gets a little bit blurry is potentially in the off season when we're trying to move someone's physique up another level, where we could potentially warrant a little bit of a higher compound load than what we're running in contest prep, and finding where that escalation of that need is going to allow that athlete to accumulate tissue to a higher level. Because with more tissue and more experience, obviously the rate of tissue gain is going to be lower, and we're going to need stuff to be able to drive that. That doesn't mean that we're going to just throw all the drugs at it from the very get-go, and need to take that time to escalate up and find where that rate of progress comes for that athlete.
Yeah, so I guess, man, what does that actually look like for someone? And
Yeah.
that's what I'll usually ask is like, what previously have you done? What was like, if I can look at pictures like around pre and post of that season to get an idea of like what that progression was, that can help. It seems easy to pull apart the variables once you see it all laid out, and then within their first week, you kind of know too how this executes. They're like, okay, there's gaps here, and even how they describe things, you'll pick up, and like, all right, they're not fully on it, or they'll send you like the meal plan. They're like, I usually follow this on most days, and like, okay, what is that? So yeah, it's like, okay, that's the dosing that they were at, that they ran. I can at least run that if I know there's variables present, or I could dial it back and try to improve the other variables, and then escalate it up. I think where we see in the off season is that for most people, it's like week one, all the gear goes in, and it makes it hard to assess like what's that doing, except a lot. Because you throw in like 2 grams in week one, it's like body weight jumps up 5 pounds, like strength's progressing along. You're like, oh wow, this is doing everything you want it to. Then it seems like 8-9 weeks later, you're just like completely stalled. And like, what do you do now? It's like, well, gear's already at the ceiling. Like, yeah, I know. How do we more progress? And then it's also, oh damn, lab markers starting to look crappy at like 10-12 weeks. It's like, oh, we need to pull back because of that. So it's just cycle planning. So that doesn't give you a great assessment, and it runs you into a wall. So it's like off season, like, you know what the previous gear was. We could start a little lower than that.
Yeah.
Let them ride for a few weeks and see what it does, and then escalate them up based on that, to where we can find where their peak dosing is. And that's like, the first few months of an athlete. Once you have that data, you're not having to do that every time. Like, I'll know with Luke, like, hey, X amount is what works for Luke. We know we need to get up to X amount. And then as, say Luke gets bigger, and that will probably need to move up more. Same with the contest prep. It's week one, you don't need to throw everything in, because you end up with the same issue. And I'll especially see on prep, like, I think it's easier on prep because you'll have people where they're like, their body weight doesn't change, but they're like getting leaner and their gym performance is like skyrocketing. You're like, you definitely don't need more drugs. That's clear. That's a clear one.
Yeah, I think something to consider too is like understanding the level of the athlete, from like what this means for the athlete too, potentially helping guide some of that decision making. This is one that I'll discuss, is like, you're working with someone who makes a living bodybuilding, right? Versus someone who is just kind of coming up the ranks to their second regional show. It's like, man, there's cards on the table, and maybe risk that's being warranted to take for that athlete that's making a living competing and trying to compete for the Olympia or go to the Olympia, versus the person that's the second regional athlete. And a lot of this just comes down to accurately assessing the need of the athlete from an overall experience level and a tissue level. But doesn't mean that we don't stray from the concept of escalating up to find the need of the athlete. It's just we have a little bit more of a better understanding of the basis that need may be higher, or is going to be higher for that athlete versus the other one. And again, genetic capacity is going to be different, right, for each individual, but it still gives you context, and as you're walking through this, what that's going to look like.
Yeah, that's a good point, because I've had people ask, like, what about the pro level? We had someone ask about this, like, what about the top 10 Olympia cycles? What does that look like? And some might be on par with what you think it would be, but others would really surprise you, because those are like the genetic elite individuals. They respond like crazy, but also they like rise to the top, and they add that size on quick. Like, a lot of those guys were top pros within 3 to 5 years of doing this. So they've already spent their time of like where they had their big growth spurts. And so at that point, some of these guys just don't need more size. And that's a different scenario because you're not having to push up higher to new limits. You're simply maintaining, which requires less. So some guys might not be using a lot anymore when you see them report that. And you need to put that in context. Like, all right, so-and-so, or like, let's use John. John says he only uses like 100 milligrams a week. Bullshit. Okay, whatever. John's been 12 for 3 years. It's like, okay. You've been the same relatively, maintaining that size, but what'd you do when you grew a lot? Like, that's kind of the question you might need to frame with those people, but also have in context, like what we just discussed. What were they masking poor variable implementation with that gear usage? But just because someone is a pro, it doesn't mean that they are advanced in all areas either. Because we get pros that we coach that they still have a lot to pull out from the variables. And that's our job to make sure we can find something like that to bring up. And don't be wrong, there's all the individuals that they nail it on every front. But even for myself, like I still find areas to improve on. I've been doing this for a while and at a high level. So there's always something to improve on. I think it is to say though, there is the individual, right, that implemented high gear earlier that comes to you that still nails everything.
Yeah, there definitely is.
There is.
And this is a hard client to work with because everything that they've had set up from like a life perspective is leading towards that end goal. And you've said this more than once on this podcast, more is more, right? And it's so like, it's a hard psychology to discuss with like, hey, like we need to look at this for the end goal over the long term. And where does that lead us over time? And potentially showing where the setup that they have right now has shortcomings from a perspective of like the concept you mentioned about being 10, 12 weeks in and seeing lab markers already in the phase. It's like, man, if we take that phase and we make it 20, 21, 22, 23 weeks, it's like tissue only accumulates so fast. We're able to be in a surplus and grow and drive the variables towards tissue accumulation for 20 to 24 weeks versus 10 to 12. From a health marketer perspective, it's like that's a better athlete at the end of the year.
Yeah, it's I'll say like with that individual, like if they played all the cards, like man, they train really hard with appropriate like execution, they nail their diet, like everything's been a part, they use that amount of gear, they've already pulled a lot of the progress out. It almost does just take more to keep them moving up if that was the need. And at that point, if you're not at the high level, you're like, hey, this is going to go really slow at this point. It's like, oh man, still don't have a pro card. Like, should you keep going for it? Because you're really running a high risk model here. Can't do this for like 10 plus years. So the decisions have to be made now. If you're like, hey, I'm going to Olympia every year, it's like, all right, well, this is what it is. Like, you're at the top of the game and you're taking high risk. Like that's just kind of par for the course for some people. Now, like you're saying, absolutely, we can try to improve and lower some of that risk by just what has been preached in the past. Like the area under the curve of gear use could be the same, rather than 3 grams over 10 weeks. This is 1,500 mgs over 20 weeks. Slowly escalating up, or something up, just to give the example of it. A lot of times we won't see like prophylactic drugs in place. Also, drug selection might not have the best rationale. We're using like nandrolone and tren all off season or something. Watch other podcasts if you don't know why that's a problem. And anadrol and D-ball.
That person sitting there that's like, fuck, that's me.
Yeah, and so it's like, oh, okay, this makes a really, really high risk model when we could get the same type of progress with manipulating. Like total gear dose might be the same, but the risk could be a little bit less. So there's still areas to pull out for that individual, but realizing like, hey, tissue accrual for that person, it's going to come really slow. So it's time to have like conversations of where they're at competitively and career wise, and what's the duration that you want to keep doing this for. So.
Yeah, absolutely. And I think that that's an important conversation to have. And understanding that even though we're sitting here with this client, pulling out these things like prophylactics, spreading out the area under the curve that may still allow us to do this better, it's still a higher risk model, right? And there is an end of the runway to that.
Yeah, and the same applies. I mentioned earlier for females as well.
Yeah. And the general discussion of like, running a higher risk model with a female and what that looks like is still going to be fairly similar. It's still, area under the curve, total androgen exposure, dosage relative to time, and figuring out where that need for the athlete arises. The complicated one is the situation on the female side with the athlete who wants to be an Olympian but still wants to have kids on the back end of it. And it's like, we've had a whole podcast on this where it's like disassociating that these two are opposing goals, and being real and objective with the conversation of expectations that you should have with a female athlete around that.
Yeah, it's tough. I think with male or female, it's just the goal is more immediate and the other is very long distance away. And so you're like, kind of put the blinders on and just get hyper focused on your goal that's right in front of you. Like, you know what? I'm just going to hit this. And you just don't think about it. You're like, it'll be fine. Like, it'll work out. And you don't put as much thought into it. And until you're in the reality of it, when you hit your goal, then you're like, wow, I wish I really had kids, or dang, I wish I didn't have like all this cardiovascular disease. And so you have to try to be mature about it and realistic, and think of what do you need to do now.
Yeah,
it's hard, right? Because gosh, when I was 25, it would be a lot different than what I would tell you than when I was 35, as far as like maybe having kids, for individuals.
Yeah.
And I think that's one piece of it. Like, you almost have to protect your athletes a little bit, because a lot of them aren't even mature enough to have those conversations with themselves. There was someone just on the J3U forum asking about like a 21-year-old female using PEDs for the first time. It's like, man, at least me at 21 and most other 21-year-olds has minimal responsibility with their own bodies to make those decisions. Like, you need to really inform this individual of what's going on, and they're going to feel invincible and do it anyway, potentially. So
yeah,
educate them the best you can, and have that client buy-in to where you can give them a few years doing this. Make sure they even want to do it. I see a female that just fades out a year because she's got bored with it. So yeah, it's on your end as a coach to make sure you can also advocate for your clients' health long-term, fertility long-term, because they might not even be in a position to care about it, but later on they would thank you for it.
Yeah, absolutely. I think that's kind of like a good overview of like the potential situations in which you see it. And I think just laying it out for the client too, like what does this look like over the long term for the goal set, and potentially how that could change the overall like long-term career setup, I think is fairly valuable. And from a client buy-in perspective, this is where the timelines I use become very valuable, because what I can do is create two and set up what the ideal would be, and then probably what it looks like doing it the old way that they did it, and show how we get more time improving with the ideal versus the old. And then that allows me to create the visual for the athlete that allows them to buy in a little bit more as well.
No, that's a nice piece to it. It's just laying out the logical thought process, right? It's almost it's nearly factual. And once you show this, like, how can you even argue with it? But, and it's not to prove them wrong. I think it's to empower them, because then they understand it so well they could explain it. And if you can explain that, how could you disagree? But also you have more buy-in as a client because you understand the process. You have that autonomy built in.
Yeah, absolutely. Is there anything else you want to cover within this conversation?
I don't think so. I know some people might hear this and like, we didn't give like hard definitives on, how much can you drop someone back by, and how do you assess them from there? And that's the art of the coaching that needs to come in, because I don't have like you dot it 30% is the not that. It's going to be this range to work within, and it's a smart point. But within a few weeks and months, you'll know this really, really quickly if this person is moving up or they're not, and you can adjust accordingly. And you just have to explain well to that athlete what this process is going to look like, so you can get maximum out of them in the future. So I think that's how you describe it, because when they get with a new coach, it's like really exciting. I'm going to see all this progress. And you like dial back their gear. They're like, I'm not really getting a lot out of this just yet. Like, I know, wait, we're setting you up for like growth over years. So it's like, just explain it to them. But yeah, that is the kind of art of coaching around this, is that there's not set ranges. It's just something you're going to have to work within to judge best off the individual.
Absolutely. Yeah, absolutely.
Cool. Well, guys, thank you everybody for tuning in. Question, comments, leave them down below on YouTube, and we'll talk to you all next time.